You too comfortable in your chair.
Do what?
I said you're real comfortable.
Oh yeah, always. I'm kicked back, got a blanket on.
You live in a dream, bro.
No, not really. Maybe after I pass this test.
You got it. You're gonna do good. You got it.
Hello, my peeps. As my kids would say. How's everybody doing?
Good.
I apologize. On the phone with my daughter, going over Thanksgiving menu dinner. She'll actually be 20 on the 26th, and she's my baby. I am not ready for her to be 20. I know, no. She's also going to graduate from college at 20 as a double major.
Oh my.
I know. But I think I've convinced her to get her master's in social work before she goes to law school. She wants to go to law school, but she's going to be 20. Law school was like for grown-A people. She's still my baby. I'm just saying. Something else I found out very interesting today. Did you have a whole career on social work in sports?
What?
No.
So a friend of mine mentioned it to me like 6 months ago. And then a friend of mine on Facebook said, does anybody know anything about social work in sports? And I'm like, well, yeah, I've got my other friend is getting her PhD in that. And I'm like, wow. So I'm like, I sent her and I said, hey, can you send me the link? Did not even know that was a real thing. Let me show you what it looks like though. This is not a trick question. I just always think it's fun to always grow and know more about like the careers out there, because I think most of us didn't have any idea that those were possible. And I don't like sports, so that wouldn't be me. But this is, come on.
Alliance of Social Workers in Sports.
I know, look at.
So the next question is, where do you take the classes?
I didn't get that far. But can you imagine working with the NBA, the NFL?
Wow, that would be cool. I like sports.
I would. My husband played pro football for a few years. And so maybe I have some issues. But I wouldn't, and I actually was the therapist for a Major League Baseball team, but I didn't know who was who, so it wouldn't matter. The NFL requires teams to retain a behavioral health team clinician who's on site at least twice a week. I know. I'm just saying. So those of you that like sports, I would just check the Alliance. Just check it out and find more about it. I didn't even know this thing existed.
I think they're finding out the value of social work in many areas that never is recognized.
And you're right. They've had psychologists forever. That's real. And there's a lot of research on sports and the mindset of sports. So definitely that's been there. But I'm like, what? She sent me this link today and I'm like, what? So anyway, I just wanted to share that with you. I'm always excited when I learn new things. But yeah, that's who they are. It's the Alliance of Social Workers in Sports, to advocate and educate administrators and organizations about the breadth and depth of social work uniquely brings to athletic and athletic cultures. There's the annual symposium. Let's see when it is this year. Maybe we missed it already. Probably. That was at Tulane. Just saying, look at that. Let's see, what are the requirements? Open.
If that says Westfield, Indiana, that's only 2.5 hours away from me.
You like oh, you're a huge Tennessee fan, aren't you? Oh, I heard this calling your name. I'm just saying.
Yes.
Let's see. And honestly, this is something, and I've been in the field for 30 years, and I know that we've been in all areas, but this is something I've never seen before. And I just always want to share. I believe that networking is really, really important. I can tell you that I got my first teaching job because of knowing somebody. And I think in this field especially, it's really important to kind of hook up and know the right people. And then, so to join, I guess, to be a part of the alliance, your email, your if you have an EAP affiliate, references, the National Association strongly believes the Code of Ethics. So that's still the same Code of Ethics. I'm just saying, like, wow, wow, wow. Never heard of it until today. I know this has nothing to do with the test today. I just always think it's important. You are lifelong learners, right? And I just want you to always be interested in new things, new changes in the career and new opportunities. So this is their current provider list. So I guess you have to be an LCSW. And you see like what they specialize in. In the states that people live in. I can tell you, so I was a provider for one of the major mental health companies for many years when I first started in practice, and I was one of their preferred providers, and I'm from South Florida. So when the Yankees were doing spring training in Fort Lauderdale, I saw a lot of the players and their wives and their kids.
Hey, you're recording everything you say. Just FYI on your.
Yeah, it's okay. I didn't tell you any names.
No, on your screen.
On my screen. What do you mean?
On
Oh,
your
it's mine.
screen every time
Oh.
you talk. Yeah.
Oh, my dictate is on.
Yeah.
That's why. So I do a lot of talk to text. That's how I wrote my PhD. I just speak it, go back and then edit it later. So I'm an auditory processor, remember? That's how I learn. I'm auditory. Okay, but thanks for pointing that out. And also again, I'll put that link in there. But am I the only one that didn't know this existed?
Oh, I didn't know nothing about it.
I didn't know this existed, Dr. Pam, but I did hear in undergrad of one of the professor's friend was a entertainer, social worker, and then they also mentioned sports. So it's interesting though.
I have a, say again?
In Texas, we have to take a sports class in undergrad. So
really?
Yeah.
Wow.
Was it elective or you had to take it?
I'm pretty sure we had to take it for part of our undergrad class.
Wow. I
Like,
never,
the
I would have
program-
died first.
Program I came out of.
Very cool. Very cool. Very cool. That's so impressive. So again, I always hope once you pass your license, and yes, you have to get your CUs, but I also hope you never, ever stop learning. Never, ever stop learning. Okay, so tonight the questions are on family theorists, and especially on my LC. Those are there's quite a few questions on there on the LC. So ask me questions in general though, and things you have questions about.
Can we talk about ego strength a little bit?
We can. Can I see your ego strengths?
No.
I cannot. You're absolutely right. I cannot see your ego strengths. So what does that mean? So if it says ego, I know it's a Freudian thing, right? right? Yes, that's a Freudian thing.
Yes.
So my
yes.
id is my what?
Principle, pleasure.
Pleasure principle. Right? That's my pleasure principle. My super ego is the angel. The angel wants to be perfect. It says, Pam, don't you dare. Don't you even think about it, Pam. Okay. So my id and my super ego are always balancing life out. My ego is who I am. That's who I work with. So ego strengths are things that you cannot necessarily see. Right. I asked my grandmother, I remember many years ago asking my grandmother, I'm like, oh my God, I learned about the depression in school. And I'm like, oh my gosh, like, how did you survive the depression? And her response to me was, honey, we always been so poor. It didn't even make a difference. So ego strengths are very, very very much up to each individual. I cannot measure them on an MSE because that is something that Freud would say is unconscious. Okay. But it's really about resilience. So there are some people who are just not resilient. There's some people who are going to give up when times get hard. And there's some people that don't. They just keep working. Am I sharing my screen? Okay.
Yes.
An ego strength is an individual's capacity to maintain his or her own identity despite psychological pain, distress, turmoil, and conflict between internal forces as well as the demands of reality. So one of the highest suicide rates in America is white businessmen. Even when COVID hit, we saw a huge surge in suicide with white businessmen. What does it have to do with their ego strengths? How are those two things related?
I guess because they're not able to adapt with life stressors.
Okay. My ego strengths are I've gone through some stuff, right? I'm resilient. I can do some things. Freud didn't say that, but I would say that many of us that have a good support system, whether it's school, through your peers, your friends at school, your religious belief system, that is what gets you through the rough days. Right. If I don't have any of that, when things get tough, I'm going to just throw in the towel. Right. So some characteristics of a good ego strength: ability to accept rejection, not as a personal affront, but as a part of life. Ability to bounce back from rejection. In other words, to be resilient. Positive attitude: where there's a will, there's a way. The tendency to see problems as opportunities. The capacity for seeing small windows of opportunity and making the most of them. I think most of you, or many of you, are retaking the test. Do you have friends that failed the first time or the second time and said, I'm not doing this anymore?
Yes.
I've had people that go back to school get a second master's because they can't pass this test. Do they have a lot of ego strength? When it got hard, they just said, I can't do this. Okay. So things that are within our control, things that are beyond our control. So do you know the term intrinsic and extrinsic motivation? Intrinsic motivation are things that I am motivated from the inside. So there are a lot of people who just want to pass the test because that's what I want. That's what I want. That's what I want to do. The extrinsic is the pressure from your job, the pressure from people around you, the pressure from somebody that comes from outside of you. So what we know, if we feel like that I have control, is inside of me. Intrinsic motivation, intrinsic control I'm going to keep going. It's because I want it. My ego wants it. So identifying within our control, okay, and this talks about, again, the things that you would look like with the clients. But if it's outside of our control, there are things that I don't have control over. So if you think that no matter how hard I study, I'll never pass the exam, will you ever pass the exam? You won't. You just won't. You just won't. Because you think there's something you can do about it. That leads to depression. If I think if I study hard enough and I give it more and I keep doing this and keep doing that, that's intrinsic motivation. And I know it may be harder. It may take longer. That's Bender's self-efficacy. I can figure it out. I can do it. I can do it. Okay. Again, some real life examples of people that use their own personal ego strength. Okay. Another term that you might see is so people that come that their feelings, their beliefs are extrinsic, many times will suffer from depression because it doesn't matter what I do, it'll never get any better. Intrinsic means that I'll keep going, I'll keep going, I'll keep going. And if I'm not going to give up, and I'm going to do it because internally that's what I want. Make sense? Okay. I was going to talk to you about protective and risk factors. You know what that terminology? There are protective factors and there are risk factors. And risk factors can be dynamic or they can be static.
Dynamic can change, correct?
Got it, got it. So give me an example of a dynamic risk factor.
Substance abuse.
Okay.
Homelessness.
What was the other one?
Homelessness.
Homelessness, absolutely, absolutely. Do you know that the fact that a child on their birth certificate, the fact that there's a mom and a dad, both have signed the birth certificate, that there is a 50% greater chance of that child to graduate from high school? Just because mom and dad both were around at the time of the birth. Okay. That's a protective factor. That's a protective factor. The fact that protective factors are things that protect me. If I have good relationships, if I have good friends, those are protective factors. Okay. So those are things that we look at. I was a school social worker for many years. And one of the things that we looked at for risk factors was mobility. If a child had moved 5, 6, 7, 8 times in 2 school years, that was a red flag. Okay, because remember, especially my little kids, they need consistency. They need to know when I come home that it's going to be the same place. They need to know that, you know, mama didn't move down the street because the rent was $5 cheaper. Those are protective factors. And what you said kindly before about the risk factors can be either dynamic or static. So my dynamic risk factors are things that I can change. My static risk factors, I can't change. Okay. If I grew up in a home where my mom and dad were both alcoholics, can I change that? I can't change that. I cannot change it. It is what it is. I can't change that. Okay. So my protective factors, they refer to the characteristics, conditions, behaviors that help to mitigate the risk of negative outcomes and enhance an individual's ability to cope with challenges. They play a crucial role in promoting mental health, as well as mental health and well-being. They buffer individuals from potential adverse effects in their community. How many of you have ever run out of gas? Most of us have. Okay. Did you have someone to call? So that's a protective factor. Now, what happened is all of us run out of gas. We have a flat. Something happens. But if I don't have anyone to call, then I don't feel safe. I don't have any protective factors. It's the end of the world because someone's going to come help me. Risk factors are the behaviors that increase the probability of experiencing negative outcomes of adverse events. So if my risk factors, if I don't have people in my life, if I don't have anyone that I can depend on, if I don't even know who my emergency, if I don't have emergency contact, those are risk factors. I'm going to handle that flat tire running out of gas a lot different than people that have protective factors. Okay. A protective factor is having enough money in the bank to be able to get gas or to buy a new tire. A risk factor is I don't even have anyone I can borrow $5 from. Okay. Yes, Dr. Pam, I've heard this before. I've seen this on the test, or maybe I saw the test and didn't know what it meant. There we go. That's it. So those are, and that is the dynamic risk factors are things that we cannot change. Put that in your chat box.
So Dr. Pam, the protective factors, to go further, would it be more like if a person who have health insurance versus ones who doesn't?
Yes, girl.
Okay.
Absolutely. When my husband died of complications of diabetes. So, and he was in and out of the hospital. Every time he went to the hospital, I had the same picture I'd always put up there. It was a picture of my whole family with him, with all of our kids. I wanted people to know that when I wasn't there, that he was important. He wasn't just some Black man, that he had a family to come home to, that he was important. Okay, I wanted that to be there. So I wanted every nurse that came in and may have just seen him as some old Black man to see him differently. The protective factors were that he had a family. He had people that were depending on him. Okay. So am I sharing my static and my dynamic risk factors?
Yes.
This is from AppGar, by the way, and I know she's awful, but I swear she's the best book for content. Best book for content. Okay. So static factors are things that I cannot change. Dynamic factors are things I can change. Okay. So I grew up in I grew up in the country. I was born in the country. Okay. I know how to wring a chicken's neck. I definitely know how to slop the hogs, and I definitely know how to cut a fish and scale a fish. I sure do. Okay. Is that a static or dynamic risk factor? Yes, the fact that I grew up in the place where I learned how to take care of myself.
Wouldn't that be dynamic?
That's static. You can't change that, can you?
Oh,
It's just that's not a risk factor, it's a protective factor. Okay. But you can't take away what I know. Okay. So static things that we can't change: criminal behavior in the family, physical abuse, witnessing domestic violence, neglect, low access of the parents, feelings of hostility, low academic achievement. Those are things that they're stuck. Dynamic are things that I can change. Okay. Lack of empathy. If I've got a little kid that's a conduct disorder, can I teach him empathy? I can. I really can. And that's the goal of teaching them when they're young. I hopefully I can teach them that hurts, doggy. Don't do that. That hurts your sister. Don't do that. Coping skills. Okay. Treatment motivation, the effective social network, right? If all of my friends are in the gang, right, I can change that. We can find some different friends. Okay, so you'll see both of those terms, static and dynamic risk factors on the exam. Okay, was there another question you want to ask me? So I know you guys were studying all week, right? What did you learn this week, Kylie?
What did I learn this week?
Yes, when you studied, tell me something you learned.
I can't.
Can I tell you something I learned this week?
Yeah.
I live in Chattanooga. Lamb chops are ridiculously expensive. Anybody live in a big city where there are people that are Muslim or different religions that don't eat pork, or many times sometimes don't eat beef? Most of it's pork.
Yeah.
Anybody live in a large Muslim community? In those cities, lamb is cheap. Did you know?
I don't know that I've had lamb.
It's amazingly wonderful. So it's so good. But in where I live, buying a lamb chop is like buying like a filet mignon. It's like $25 a pound. I mean, ridiculously expensive. But I have a friend in Chicago. I have a couple of clients also in Chicago that, because it's a very diverse city, that lots of people eat lamb and it's not so expensive in other cities. That was my diversity lesson of the week. Okay. Okay, Kylie, you had to learn something this week. You studied. Come on, tell me something you learned. I'll come back to you. Rochelle, I know you studied this week. Tell me something you learned.
Well, that's why I asked you about ego strength, because I was kind of confused. Because that's why I am in the APGAR book.
Mm-hmm. So you learned what ego strengths mean.
Yes.
Okay. Dion, something you learned this week? Because you studied, right? You studied for 6 hours at least, or 3 hours, 6 days a week. You all studied, yes?
Got you in my head.
Tell me something you learned this week.
Congruence and incongruence communication.
Okay. What does that mean?
Congruence in communication is when your words match what you say.
Absolutely.
Incongruence is the opposite.
Absolutely. What theorist said it was really important for the therapist to be to have congruence. He called it genuineness or congruency. What theorist said that?
Is it Freud?
Freud was unconscious. Freud was the expert.
Unconscious.
You stupid woman, you know nothing. That's what Freud would say. He's the expert.
Okay.
Unconditional positive regard, genuineness, and empathy. Anybody? He's a biggie.
Erickson.
No, he's a developmental guy. This was a theorist. That means he was someone who did theories.
It wasn't Adler, was it?
No, it was not Adler. The client is the expert. All I have to do is sit there and support them.
Oh my Lord.
Carl Rogers.
Carl
Rogers.
Yeah.
Does everybody know Carl? Okay. He's going to be on all the tests. All the tests. BS, MS, MSW, LCSW. He's a huge deal. Carl Rogers purposely came along after Freud. Freud said, oh, you poor dumb women, I'm the expert. You can tell me what you see in the Rorschach. You can tell me what you see in the ink blot, but I'm going to tell you, you're wrong. This is what it really means. So Carl Rogers came along and Carl Rogers said, the client is the expert. It's their life. They know what they're doing and they're the expert. So if a client comes to me and he tells me that, you know, this awful thing he did, I have learned unconditional positive regard. I am not going to think he's a bad person. I'm going to own up the fact that what he did wasn't so great, but I'm definitely not going to say, you did what? Right? Carl Rogers said, if the client is the expert in their lives, if I am warm, if I am genuine, if I am real with them, then they can figure out by themselves how they need to change. So he was purposely an opposite of Freud. Carl Rogers also did not diagnose. He said, if I diagnose what is normal behavior, what I believe is normal behavior, then it'll be seen as a pathology, and it's not a pathology, it's normal behavior. Yes, makes sense? Tell me you've heard of Carl Rogers before? You have not, definitely go back to the APGAR book. Okay. Also, if you go to any of my YouTube theories on knowing your theorist, Carl Rogers is a big one. He's a big one, especially for my LC people. Make sure that you know who those people are. Okay. I totally forgot where I was going with that. Okay. Other questions, something you've seen on YouTube, TDC, Liz, any of those other therapies, something you've seen already that you want to ask me about?
Habit reversal.
Habit reversal?
Mm-hmm.
Most often that's called counter conditioning.
Mm-hmm.
What does that mean?
I don't know, but I had a question where it said habit reversal is a technique that is shown to be effective in treating, and the option was obsessive compulsive disorder, specific phobias, attention deficit hyperactivity disorder, and trichotillomania.
Trichotillomania.
And
okay.
I didn't know the answer, but the answer was trichotillomania.
Okay, so what was my first response when you asked me?
You asked me if I know something.
So I said counter conditioning.
Yes.
Okay. So read your question again.
Habit reversal is a technique that has shown to be effective in treating.
Okay. I know it's a behavior technique.
Mm-hmm.
You've learned this habit, and now I'm gonna do something different. So I know that before I even read the question. Okay. So think about counter conditioning. People are trying to stop smoking. Every time they're used to having sex, right?
Mm-hmm.
I'm sorry, they're used to smoking after they have sex.
Okay.
If I'm trying to teach you to stop smoking, I'm gonna teach you some new things. Okay. So instead of pairing sex with smoking or food with smoking, I'm going to try to pair that with something else. I'm going to try to counter condition you to what you're used to.
Okay.
What is trichotillomania?
Pulling off the hair. Pulling.
Okay. And what kind of disorder is it?
Is that
right?
It's a compulsive behavior.
It's an anxiety disorder. Absolutely. Okay. So the goal is if I'm trying to stop that anxiety disorder, that OCD disorder, I'm going to teach you new behaviors instead of pulling your hair. The best treatment for that also, CBT and medication. that's a mood disorder, an affective disorder? And the answer is always, the disorder is CBT and medication. Did you know that? Or was that, were you stuck on that question?
No, I didn't know the answer, but the answer that I did choose was A, obsessive compulsive disorder. And then I saw the answer, which was D, trigger two.
So obsessive compulsive disorder is it's not a mood disorder. That is one that, so OCPD is the mood disorder. OCD is I need everything to be perfect. Okay, keep going.
Oh, that was one of my questions, but
Okay. Anybody else?
In cake and separating the yolk by hand, I could.
Okay. So the conversation tonight, I'm going to put that in your chat box. Let's put the dynamic and static spectrum. So tonight we're talking about our family theorists, okay? So on my LC, it's really, really important that you know the technology, that you know the verbiage that a theorist would use. On my LM or my BSW, you just need to know the basics about what the theorist would do, okay? Who's Brian Finbremer? In school, I swear you did. Right. Finbremer did my ecological system. Always on the test when you say things about, oh my gosh, it's macro social work. Oh, freak it out, right? Ah. Yes. So Braun Finbremer is the one that brought systems theory to social work. It's been around forever and forever. We didn't come up with it. We borrowed, we extended it, we used it in our theory, but we definitely did not come up with it. So when I see macro, meso, MES or MEZ, I know that's what we're talking about. Am I sharing my screen?
yes.
Okay. So Braun Finbremer talked about these things. I'm not going to use that one because that doesn't give the clinical terms I'm looking for. Okay, you see this one? You there? Yes, you're there.
Yes.
Okay, let me share my screen again, make sure you see it. Okay, you see my screen?
Yes.
Okay, thank you very much. Make it bigger for you. Okay, so Braun Finbremer was the ecological system, okay? So what he taught, what does systems theory say? Anybody? No man is an island. What does that mean?
You build your island. You have to reach out.
Okay. I don't necessarily, yes, it's important, but there's some things in life that are going to affect me no matter what I do.
Yes.
Okay. My microsystem is different for everybody. In a child, their microsystem is always their mom, their dad, their school, who takes care of them, all those things, because the child can't live by themselves. That's their microsystem, right? All the things that support them personally. Micro social work is individual. That's doing therapy with an individual. Meso, M-E-S or M-E-Z, then takes it out to family, community, the bigger picture of things. My meso, M-E-Z-O, maybe, or M-E-S-O, may look different than your meso. Okay. So for a lot of people, church is their family. Okay. I'm a preacher's kid. When I was a kid, the only people I ever really was close to were people that went to church with my dad. That was my family. So MES or MEZ is your meso system. But again, my meso system may not look like your meso system. Okay. Your exosystem, again, is getting bigger. We've got extended families, neighbors, and then macro system, of course, the macro approach to social work talks about laws. It talks about community changes, right? All of those things that affect you, again, individually. So Braun-Finberger's theory is that everything is interrelated. If dad loses his job and Johnny starts to act out, aren't those two things related? Absolutely, absolutely. Okay. The chromosome system, environmental changes that course over the life course. So what are some environmental changes that have happened in the last 10 years in all of our lives? Outside the United States, outside of America, that are global things. Sister?
COVID.
COVID. Yeah.
Okay.
COVID.
So when COVID first started, what did we think? Before it hit America, before it was in other countries, we saw Italy shutting down, we saw Germany shutting down, we saw China shutting down. What did we think?
That it wouldn't happen to us.
Wouldn't happen to us.
No.
Okay. Like, them people over there, that ain't gonna happen to us. So the chromosome system has affected everyone. We can talk about global change, global warming. Okay. So I moved to Tennessee about 13, 14, 15 years ago. And I left South Florida because I lived through the year where there were tons and tons and tons of hurricanes that season. And when I moved here, our realtor said, don't worry, tornadoes never happen in Tennessee, and especially where I live in Chattanooga, the Valley, never happen here. And they had never happened until about 5 years ago. My house is brand new because what used to be here was totally wiped out by the hurricane, totally gone. I live between two mountains, and the theory was that because of the mountain ranges, the tornadoes would go across and they would never get in the valley. Not true. Okay. Did you see the last hurricane that hit, what was it? It hit Mexico, and it sped up so quickly in the last 24 hours, things that we had never seen before. It was usually, I'm from South Florida, so when a hurricane comes, we get lots of warnings. It's a cone, right? This is where you are. Lots of warnings. We know if it's going to be a 3, in the past, 3, 4, 5, whatever. We're ready. But you won't see a lot of people dying from hurricanes because we're ready. We know we have plenty of time to plan. This one sped up within 24 hours that we had never, ever seen before. Does the change in the climate affected our chromosome system? Has it affected you personally yet? If not, it will. a couple of things we look at that. In our macro system, the big picture, we have tons and tons of people that are now beginning to immigrate to or try to immigrate illegally to America because of the weather in Guatemala, in Mexico. It's not raining the way that it used to. Temperatures have risen. So people can't afford to feed their families because there's no water. That's one of the biggest reasons for immigration to try to get to this country. Okay. Have you seen the price in grocery stores go up? What's that got to do with anything? How's that? Where did that come from? Kylie?
Inflation.
From where though? Why is inflation? Where does that come from?
Everybody's going for it. And everybody is trying to get it at the same time. So they just got to keep driving the price
So
up.
are there less resources? Is there less bread? Is there less rice? Is there less grain?
There's
Sister, what do you think?
I'm hearing it is as a result of the war in Ukraine, so I don't know.
Okay, I would agree with that too. That's definitely one of the reasons. Most definitely one of the reasons, because the Ukraine is shopped. There, a lot of the rice was from there. I definitely agree with that. Anybody live in Texas? Anybody live out west where there used to be these amazing grain fields and amazing cows, and we got a lot of stuff from there, and now it's just not there. That has to do a lot with climate change. Okay, I have cattle friends that are cattle farmers. So before, if you grew your own grass and the cattle had enough to eat, but now it's not raining the way it used to be. That the temperatures have gone up. So now my cattle farmers that have to go out and buy wheat and other places to feed their cows, right? That price has gone up. So then now it costs us more. So there's no system, no chromosome system that's not going to affect you. It hasn't affected you yet. It will. It will. Okay. So that's the theory of Bronfenbrenner. Everything is related. We can't pretend that we live in this world that what happens in China doesn't affect us. We can't live in this world that can pretend that what happens in Ukraine doesn't affect us. Okay. Bronfenbrenner also then came up with the eco map, right? He did not come with the eco map, but that's the eco map comes from this theory. What's my eco map and how's that different than a genogram?
Eco studies your environment, Geno studies your family.
Absolutely, absolutely. So an eco map looks at the people who are in your environment, and the genogram looks at the things that are definitely related to the things we can't control. I love the genogram this time of year. How many of you are doing exactly the same thing that your mama and daddy did for Thanksgiving this year? Same food, same process, same plan. Anybody do anything different? Kylie, what are you doing different this year?
I'm working.
So there's not gonna be any turkey at your house?
My family's going to other families because I'm not gonna be here to fix it.
Are you usually the Thanksgiving host?
No, but I usually help take.
Go ahead. You usually help take
The
you
food.
help cook?
Yep.
Okay. Are they gonna be okay this year, Kylie?
They better be. That's all I can say.
Deanna, I saw you raise your hand. So what usually happens, what's happened in the last couple of years with your family?
The last couple of years, my dad does the fried turkey.
Okay.
Fries it. We usually pick up the turkey and take it over and thaw it out, and he does that. And then I usually cook the collard greens, and then everyone has a dish they bring.
God. Does everybody pretty much bring the same dish every year?
Pretty much. Pretty much. We changed
Dion-
now with
Dion-
Christmas. We choose different. We choose a theme at Christmas,
Okay, okay.
so that's changed.
Okay, so for Thanksgiving and your collard greens, do you make them the same way that your mama did?
Well, no, because in the beginning, my mom used to cook with the smoked ham, but
Ham
now
or ham hocks?
I mean the ham hock, but now we
Okay,
do
girl,
smoked
come on,
turkey.
be black, ham hocks.
Yeah, now it's smoked turkey. We don't do ham hocks, and we hadn't done.
Look at that. Bo would be so proud of you.
Yeah,
that you like. We can't keep doing this. Some of us gonna die.
keep doing it right.
That's what Bowen would say. He would say we keep doing the same things over and over again without questioning why.
Yeah.
Okay. So most definitely. Anybody else want to share their especially Christmas is we can change most often because Christmas is that one day, but Thanksgiving we usually do the exact same thing that great granny did, my great granny did. Everybody keeps doing. Evelyn, what does Christmas look like in Thanksgiving look like in Canada?
Our Thanksgiving here it's a month earlier. It's in October, second week in October.
So what does it look like?
I think it's similar to American. Families get together, we get the weekend off, families get together, turkey, that whole turkey thing.
Evelyn, do you do the same things that your mom and your grandparents did on the holiday?
No, I immigrated here with my mom from El Salvador. So we don't have those sort of tradition there. So yeah, no, my family is different. We don't follow traditions.
Have you not incorporated some things that are El Salvadorian in your meal? In your cooking?
No, not really. Like I'm not really attached to my culture per se because I was kind of young when I came. So
okay,
I don't know. I'm just a beautiful mixture of both of different worlds, I guess.
So I'm going to say there, the term is immediacy. When you're in a moment, I'm going to turn into a teaching moment. So have you assimilated or are you still acculturating?
I think I'm assimilating, but 2 years ago, I actually discovered, a year and a half ago, I discovered my indigeneity. And so I don't know.
Your what? Your
indigeneity. Like I'm indigenous Salvadorian. That's something that I discovered a year and a half ago.
Indigenous. That means that your family comes from the native people.
From El Salvador, yeah.
Yeah.
So it's like a new journey for me. So I feel frustrated because I was, colonialism has impacted my family and tradition and all the stuff. So yeah, I think twice, back in El Salvador and then coming to Canada, there was another change in transitions,
Are you suggesting that rich white men affected your life?
They what?
Rich white men affected your life?
They what?
Who affected your life? AFF. Colonization was by who?
Europeans,
rich
people?
White men. Okay, exactly. So
yeah.
Yes. So when you think of colonization, it doesn't matter where you're from naturally or where you're born. Colonization is people that had money, and again, most often looking at rich white men, colonized the whole wide world. So so that is so assimilation means that you're more like the Canadian culture. Acculturation means you keep your El Salvadorian traditions, and you then add the Canadian traditions to your El Salvadorian traditions.
Well, I don't know. It's interesting because I didn't give up my culture consciously. It was just an unconscious.
So that's a Freud choice. Freud says it's unconscious or unconscious. Most of us adapt. Right? We learn to live in the new environment.
without thinking, like, I just like, and I was young, right? So, and it was just like a year, like when I started my academic journey, like 3.5 years ago, and then a year and a half ago, it hit on me that, oh my gosh, I am indigenous. So I walked all my life not knowing who I was. Yeah, that, don't know if that makes sense to you, some of you, but like,
I would think that most of the people in this room have indigenous roots. That coming from whatever country you are from originally, so whether it's America, and you can many times do your bloodline and go back to whether you were Cherokee or Mississippi or whatever Native American tribe. And especially if you're of color, you can usually trace your roots back to some original tribe in Africa. So I think all of us are kind of in that same boat.
But it's interesting, like, I think, our experiences, differ. And like, I think we all like, I don't know, like in my family, they think I'm going nuts, but for me, it's so significant, and it's so like, frustrated on the one hand that, I don't know how to connect back to my roots, obviously, because it's some damage had already been done. But at the same time, I'm kind of like a limbo, like you don't know what you fit and where you belong because of you were.
That term is called marginalized. Marginalized means that now you live in a different community. You haven't totally accepted the new community, and you're still not even sure of your own community. So you feel like you don't belong anywhere. That's a test question. That's heard marginalization.
Oh, that's marginalization. Yeah.
Yeah. You see my screen?
Yeah.
Okay, so family systems is where it started. So when we get into structural and strategic, you'll find why it's so hard to figure out who's who, because it very much came from the same thing. Mnuchin is structural and Jay Haley is strategic. And you know what? They were buddies. By the way, Mnuchin is from El Salvador.
Who?
Mnuchin is from El Salvador.
Who is Mnuchin?
He is that structural family guy.
Really?
Yes.
Ooh.
Okay. So Mnuchin is the structure. So let's learn some terms. Make sure we know the terms. Okay. So
that name sounds indigenous.
Yes. Okay. So do you see those boundaries between mom and dad? They have their own boundaries, and now they also have the parental subsystem. So what are those? These lines mean what? Is it an open system, a closed system? Can everybody get through? What does it mean? Natalie?
Sorry. You said what the lines mean?
What does it tell me about this family just by looking at the lines?
Well, I know that the husband is the head of the household.
What is that?
Hmm?
You brought in some Natalie stuff. In systems theory, do you see that mom and dad are equal?
Yeah.
Okay. In many families, okay, especially our Hispanic families, many times things like that, dad is in charge, machismo. But in Mnuchin did not talk about people of color or people that, again, rich white men. Okay. So in a system, according to Mnuchin, we're equal. Mom and dad are equal, and they're also in charge. And these boundaries are called permeable or semi-permeable. What that means is that everything can't get through. Some things can come in through that relationship, but not everything. All right. So growing up, what was the rule about going into your family, your mom and dad's bedroom? What was the rule in your house?
Knock before entering.
Oh, okay. Anybody else?
We were not allowed in there.
Absolutely. Not as I grew up. Just don't go in there. I'm be pretty sure that, and of course we didn't have cameras back then, but I know I knew that I would just die if I went in that room. If I crossed the line, go in there. What else? Evelyn, what was the rule in your house?
For what?
Going in your mom and dad's bedroom.
Oh, I'd rather not comment. It's kind of triggering for me.
Okay, I understand that. So when you grew up in your family, there were usually some rules. So systems family theory says mom and dad are in charge. There's no family theorist that's ever going to say that children are on top. Never, 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 never. That is never going to be the right answer. Mom and dad are in charge. Mom and dad, biological mom and dad are in charge. Okay. And we see that the parental subsystem, they're a system, but they're still their own people. Children are a subsystem, but they're still their own people. So we talk about the eco map. The eco map talks about all of those things that are coming into the system, whether it's dad's job, friends, the kids' friends, people from church, all of those things were coming in to support this system. Input is what that's called. Input comes in the system. It's called throughput when it's in the system. That energy that comes in helps mom and dad be mom and dad. It helps them support their kids. And hopefully then they can output to the next system. Okay. Should this system close up and things not come in, it becomes like close a system. See these lines that are now semi-permeable, where some things can come in, but not everything. If that, let's say that mom starts, mom has an accident and she's now addicted to pain pills, and then she becomes addicted to heroin. Okay. So mom's now a heroin addict and she's out on the streets trying to get drugs. So dad's trying his best to hold it together, but dad can't, he's trying to work and he keeps being late to work. He's about to be fired. The kids aren't go, they go to school, they aren't half dressed, they're missing meals, all of those things. What's going to happen to the input? Are people going to keep coming over and hanging out with them?
No,
Friends going to come over to my house and hang out with me?
no.
What's that term called?
Entropy.
Entropy. There we go. There we go. Entropy. It's going to die. We didn't create that term. It came from biological or came from any other mechanical system, right? If you give me a plant and a live plant and I put it in my closet and say, thanks, put it in the closet and I don't give it food and water, what's going to happen?
It'll die.
It's a closed system. It's going to die. Entropy is the dying process. Okay. So let's get back to this family. So mom's a heroin addict. Mom is not making dinner. House is a mess. It's nasty, gross. Dad's going to get fired from his job because he's trying to take care of mom, trying to get the kids to school. So this system is, entropy means slowly dying. Okay. CPS called the schools, they aren't showing up. They get a call from CPS. So the kids aren't coming to school. And when they do come to school, they're nasty and they smell gross and no one wants to be around them. If nothing happens, this family will die. CPS will come in and take these kids, and this whole family unit, as we've known it, will disappear. But no, Rochelle's going to come in with her superwoman cape. Save the family, save the family. Look at me, I'm going to save the family. So Rochelle is going to negate the entropy. Negative entropy is a good thing. She's going to stop the family from dying. She's going to come in and she's going to put service in the home. She's going to put mom in rehab. Okay. She's going to put some services. She's going to get, you know, I don't know what state you live in, but most DFACS offices work with one of those cleaning agencies that come in and clean up the home, especially of hoarders. So she's going to get some referrals. She's going to come in. These people are going to come in and clean up the home. They're going to get rid of the dead rats that have been there for like 3 weeks, right? You've seen hoarders. Come on, yeah, I'll see hoarders, right? So he's going to come in. She's going to get the house clean, get things set up. She is going to help dad manage his time to realize how to understand how the kids get to school and what needs to be done. We're probably going to put the kids on free lunch because if dad's the only income provider and he can't pack their lunch, let's make sure they have free lunch and free breakfast at school, right? So Rochelle is going to stop the dying process. That's called negative entropy. Negate the dying process. Okay. So entropy is the family's dying. Negating that dying process is what we want to do. We want to stop the family from continue to die. Hopefully we can reopen the system, put in new, again, reinforce resources from the environment, and we can save this family. So family systems theory says everything is interrelated. It talks about boundaries, hierarchy, entropy, negative entropy, thorough put. All of those things come from this theory. Evelyn?
Oh, sorry, probably you all know this except me. How do you spell entropy? You keep saying the word. I'm not quite.
Hold on. I will show you. I will show you. It is in the APGAR book. So what I'm always going to say is if you put in entropy, always put in plus counseling, plus psychology, social work, any of those things so you understand what it means in our world. The goal is always to increase your vocabulary. Am I sharing? Yes. In social work, entropy is the level of disorder in a social system. Social workers often help people with problems which can be seen as chaos. Entropy is the measure of disorder between theoretical, and statistical interpretation. Entropy can be defined as a degree of chaos, randomness, disorganization. Negative entropy can be defined as a degree of order and adaptiveness as a family. Entropy is, the family is a mess. It's about to fall apart. It's going to die. It's slowly going to die. If I come in as a social worker, my goal is to stop the dying process. Social workers believe in our heart, in our core, that biological children belong with biological families. We believe that mom and dad just don't have the right information. They don't have the right resources. I know all of you that have been in this field for half a minute, somebody says you're a baby snatcher. We are not. I tell people, I don't even want my own kids. Why would I try to take yours? Okay. So we're not trying to snatch your babies. What we want is to teach you, to educate you on how to be effective parents. If you're a drug user, we're going to send you to treatment. If you need parenting skills, we're going to send you to treatment. Our goal is, as social workers, is that biological children belong with biological parents. That is at our core, that's what we believe. And we believe that people who lose their children just need more education, information, or support. Anybody been called a baby snatcher in this room? Baby snatcher? I'm like, I only like my own kids. Why the heck would I take yours? Okay, exactly. I'm trying to get rid of mine some days. They're grown up now. So, but honestly, many people think all social workers do is take kids. That's just not true. That's just not true. And even if I work for Child Protective Services, my goal is to keep the kids safe. but I'm not trying to take him away from his biological parents. I'm trying to give the biological parents the resources that they need to be effective parents. Okay, that is entropy and negative entropy. I'm trying to negate the family dying process. I don't want that to happen. Okay, so back to family systems. So what we'll find as we go into Braun van Bremer, and I'm sorry, as we go into structural and strategic, you'll see that many of these terms are the same. Okay. So Minuchin is my structural family guy. Somebody tell me what Minuchin said. Oh, words that belong to Minuchin.
How do you spell that, Dr.?
Well, let's pull it up in the text.
Is boundaries part of it, Dr. Pam, structural?
It is. I cannot tell you, especially at all the levels, you've got to know this. You guys know that we work with families like all day, every day, right? That's what we do. Yeah. Got that. We're good.
He didn't create the genogram, did he?
He did not. Who did that? Come on. You did it in school. That means
Bowen?
Bowen. Yes, that was Bowen. Bowen said, you're all one big old nasty. Oh, he didn't say nasty, but he said, you're one big old mess, right? We do what mom and him did. And I say nasty because I work with so many families that do the same thing. I work with families who the current adults think it's funny that Santa Claus didn't come because everybody got high, and then Santa forgot to come, and their mama did it, and they did the same thing to their kids. That makes me want to like choke them. That's when I have to find the strengths perspective, right? The things that are working for them, things that are doing well. Am I the only families that you just want to choke? Don't hear some families that you just like, you don't need these kids. That's what my internal voice says, right? My external voice, my values say that's not true. I want to support you. Okay. Everybody else but Rochelle and I, y'all all work with families that you really like and you support them and believe in them, right? Just me and Rochelle. Natalie, you ain't work with no families you want to choke?
I don't want to work with no families. Absolutely not. My daughter makes up for like 10, so no.
So who's your population, Natalie?
Sorry.
My population is mental health. Clients with mental health issue, finding appropriate apartment for them.
So they don't have families.
It's adult clients and they share apartment with one another. So I don't really see the client family.
Okay, so I'm assuming that your population doesn't have families, or that's not part of the issue.
They do have families. It's not part of the issue.
Got it. Sister, you work with little children, don't you? You're muted. Oh, I still can't hear you, sister.
I used to, but no longer now. I work with couples.
Okay. When you are working with children, were there not some days when you're thinking these mom and daddies should not take these kids home?
That situations, yes.
All of us do. We're human. We're
Yes.
human. And I think all of us are females in the room. And I think that's countertransference, especially because we're like, you know what? I bust my butt to take care of my kids. I do this, I do that, I do that. And I'm looking at a mama who can't get out of bed to feed her kids. And she spends money getting her hair did and her nails done and not taking care of her kids. So I think that's countertransference. It's really okay. Be aware of it, but we're human. We are human. And there are days I'm like, oh my gosh, you don't get back. Okay. I go again, I don't treat a lot anymore. But I go back and like, okay, Pam, go back and figure out what's going on, what's the issue. My countertransference is getting in the way. And my goal, of course, is to really help mom or dad, or mostly mom, learn the skills that she needs to learn to get her children back. The assumption is that people don't know any better.
Dr. Gamma, I think I wrote down in my notes that you said Bowen wanted to like rock your homeostasis or something like that.
Minuchin.
Oh, I mean, I meant to say Minuchin. Yes.
Dr. Penn, are you looking for Manichin?
No, I'm going to go through families in general. Okay.
Oh, okay. So Manichin is actually Argentinian. It's from a place called El Salvador, but it's in Argentina.
Ah, gotcha.
I just looked it up.
Okay, so I just want to go through some of the terms that it comes to family. Yeah, I do. Yeah. Okay. So I talked about systems theory to begin with in general. This is Bowenian. Am I sharing? Okay. Authoritarian, authoritative, permissive, and uninvolved parenting. Which is the worst?
I thought the first one is the worst.
It is not.
Is the uninvolved.
Sister?
Uninvolved.
Uninvolved is the worst. I don't even know what my kids are doing. I don't know their friends. It's 11 o'clock in the morning and no one has showed up. The kid didn't come home. I have no idea. Uninvolved is the worst. Okay. I was a Girl Scout leader for both of my daughters in their troops. We took them all the way to their gold. And one of the things that I had a little girl who we went bike. I'm Tennessee. It's beautiful this time of year. We go bike riding. We're outside, and she didn't know how to ride a bike. She's like 10 at the time. How do you not know how to ride a bike? There are not kids in Tennessee that don't know how to ride a bike. That's just not a thing. We're always outdoors, and she said no one ever taught me. That's uninvolved. Okay. We do not like authoritarian parents because children who come from authoritarian parents have never learned to do anything by themselves. They do what they're told, what to do, how to do it, etc. My 19-year-old is in college and a lot of her friends don't know how to do their laundry. Because their mama said, don't you touch my washer and dryer, you're going to break it. Have you ever heard that? That's just okay. So authoritarian parents, I'm in control. I'm going to tell you exactly what to do. But the kid never learned what to do by themselves. They've never learned to make mistakes. They've never learned to fail. Authoritative parents are what we want. That's the best kind. Authoritative parents are talkative. Talkative. But remember, I'm not going to negotiate bedtime with my 3-year-old. That's not going to happen. But as you get 13, 14, 15, 16, we're going to talk. I would much rather know what my kids are doing so I can tell them. What I told my kids is your friends know less than you do. Don't ask your friends questions about sex and drugs. They know less than you do. Ask me. Was it always comfortable? No. One of the things when I taught parenting classes, I would always say, when you have those uncomfortable conversations, drive. Be in the front seat and the kids in the back seat. And that way they don't have to look at you. But I've got to have those conversations because if I don't have the conversations, they're going to listen to their friends or be like my mama who just gave me a book and we never talked about it. I did not want that for my children. I had friends when we started college that, that they went back to a boy's room and they were surprised that the boy wanted to have sex. But if no one's ever taught me that, how would I know? Authoritative parents are the best kind. We talk about it. We talk about it. My children all get one get out of jail free card. That means you get to mess up, you get to do whatever one time, and mom will take care of it. No questions asked. No questions asked. One. The second time, you're on your own, okay? So, because also they're my children, and I definitely needed to get out of jail free card, okay? So they're my kids. Authoritarian, strict, authoritative, the best. Permissive, you just want to be your kid's friend, and uninvolved is the worst, okay? The family life cycle. The family life cycle means that we start with our family of origin, the people that are with us, right? Mom and dad, and I'm a child. I grow up, I'll leave home. Okay, I'm gonna spread this out. You get married before you have kids, just to clarify that, okay? I'm Carl Rogers, no judgment, but this is what the test says, the right test answer. You leave home, you go to college, you get settled, they're premarital tasks, right? You're a childless couple, you get married, and then you have children. Okay, kids grow up. I launch them to get onto their own life. It becomes the later in life series, and you know what else? I die. Does the family life cycle go on after I die? Of course it does, right? My children will have children, all of those things. The question you might see is a crisis in a family life cycle. So my husband died. And so 8 years ago, and my kids, two of my kids are still really little. So because he died, does that mean they don't get to go to college? Does that mean they won't get married? So whenever you see a question about the family life cycle crisis, you have to deal with the crisis at the moment, but also to help the family prepare what did it look like. There's not going to be anybody walk my daughter down the aisle. That just is what it is, okay? So that's what it means. Understand that it's not only just for right now, life goes on. Just because there was a crisis, it goes on. So not only the family has to adjust now, but they have to be prepared for things in the future. Okay, it talks about family dynamics. So healthy functioning in a family. We treat each family member as an individual. We have regular routine and structure. I want to say to you, is there an IP, that term IP? Is that a real, is that happen? The IP is the individual, the person who's acting out. Most theorists say that IP is not real. The IP is the person who draws attention to the family. Okay. So the kid, we can go back to, what is triangulation?
When a third,
When
sorry,
the third, okay, go ahead, sorry.
you could
Okay.
go, Emma.
Triangulation is when two people are speaking, but are using a middle person to transfer information to the other party. Like husband and wife will use their child as a middle person in between them.
Okay. So it is not necessarily that it's not necessarily about speaking, but there are two people that are fighting. And what we do is there's a third person involved. So it can be mother and dad are fighting, and that mother and dad talk about divorce, and then the child starts acting out at school. Because now he's drawn the attention away from mom and dad. So now they're focusing on him. Okay. So triangulation is, again, one of those really big family terms. I want to go back to my family theorists and really get those in.
So, Dr. Pam, so the triangulation doesn't necessarily have to be where the third person is like actually there. It sounds like it was once two people, or at first two people, and then one now is also involved.
So the problem is there's a fight between the two.
Okay.
Mom and dad, mom and daughter, mom and her mom. Okay. So personally, I can talk about, so my daughter, I want to kill her. I want to kill her because she's done some something. And I'm like, to my husband, you better get in here, come here and get this kid before I kill her.
Okay.
Okay. So it's two people in a family that are having a disagreement. They're fighting, there's conflict. And the third person comes in to stop the conflict. Okay. They can be brought in or they can step in either way. Does that make sense?
Yes, but earlier you said that the mother and father were fighting, and then the child was doing something at school.
Exactly, because he did not want his mom and dad in divorce. So if he begins to act out, he knows they're going to focus on him and not on divorce.
Okay.
That's a really common one. You'll see that families who like kids, especially kids, know so much more than we think they know. And so they've overheard mom and dad getting divorced. According to Piaget, what do little kids think if mom and dad are getting divorced?
It's my fault.
Absolutely. It's all about me. It's about me. So then if I draw attention away from that, then they're going to then realize that they need to do something different. It's not about me. So systems theory broke into two schools, structural and strategic. Okay. Haley is the one that you'll see. Haley talked about how we talk to each other. My strategic family therapies are just about how we talk to each other. These families are not about to fall apart. They're a little bit unhealthy, but it's not the end of the world. Okay. So what we know is, so this term is called circular causality. This is most often an LCSW term. So what happens in this circle, right? The son behaves better. The parents ignore the son behaves, and now the parents give him more attention. And it continues and it continues and continues. If we don't understand what's gonna happen, we don't understand what's happening in this pattern, it'll never stop. This is triangulation, right? Mom and dad ignore the son. Son is like, okay, I'm gonna get your attention. I'm gonna begin to behave. I misbehave. Okay, that term is called circular causality. This is especially an LC term, first and second order changes. First order changes are fake. First order changes is when I've got a family, let's say a step parent, a stepmom, and 3 kids, right? So what I want one of the kids to do is weekly to say to the stepmom, or every day, tell the stepmom something she did good. Just tell her. Dinner's okay. You're not so ugly. I'm not really glad you married my dad, but you're not the worst one he dated. It's fake. But what happens is if I keep faking it, it becomes real and it becomes a second order change. I can't get to a second order change until I learn a first order change. First order changes are fake. Right? They're supposed to be fake. So what strategic says is how we talk to each other, how we have verbal communication with each other. So if I change the way that I talk, eventually that will change the way things are. We can go back and say that's biblical. The Bible says life and death lies in your tongue. if you change the way that you talk, eventually the whole world will change. Your world around you will change. If I wake up every day and tell myself I'm a rotten loser and I will never become anything, that's going to happen, isn't it? Life and death lie in your tongue. It matters what you say. So if I can get this kid to say something nice to his mom, whether he believes it or not, it'll get to the second order change. Okay. These are terms that you'll see. The paradoxical, or sometimes it's called prescribing the symptom. What does that mean?
So for example, say, oh my goodness. Okay, so let's just say, I'm trying to give an example. The husband and the wife is arguing and the social worker assigned homework and neither one of them is doing it. And then when they're in session, the social worker will ask the couple to act out.
So what's happening? Yes, you're so in the game. You're so in the game, okay? So the paradoxical is the opposite, prescribing the symptom, okay, or the paradox. Can I tell someone who's suicidal to go ahead and kill themselves? No, can I do that? Absolutely. So the paradox is reverse psychology. But what happens is, let's say what you said, Natalie, I've been seeing this couple. I've been seeing them for weeks and weeks and weeks. And they keep saying, we can't talk to each other. She doesn't listen. He doesn't listen. And I've given all these techniques. I said, so what I want you to do is to go home and use I statements. What are I statements? This is on all the tests. What are I statements?
What do you want from them?
It's describing my feelings when you behave this way. So if my husband comes home late for dinner and he comes to the house and I'm like, where were you? I had dinner 3 hours ago. What's wrong with you? Whatever. What's he going to say to me?
You're probably not even going to answer.
Exactly. He might walk out right back out the door. Okay. I statements are, I feel really worried, or I'm really worried when you don't come home for dinner on time. I'm concerned, because that's usually the real feeling, right? Where were you? I'm concerned. I worry about you when you don't come home at your normal time. The feeling based on the behavior. Those are I statements. Okay. One-on-one couples therapy. Whenever you have a couple that's you're working with them, that's the one thing that you always want to do is teach them I statements. It's not blaming you for what you did. It's letting you know how your behavior made me feel. I get worried when you don't come home. I'm afraid when you don't call me. I statements. That's all areas of social work. That's something that everybody needs to know. Okay. So, however, so I said to the family, I've said to the couple, I need you to use my statements. Okay. They come in the second week and he doesn't listen to me. It's awful. I can't stand this. They didn't use the I statements. I'm going to use bibliotherapy. What does that term mean? Natalie, where are you from?
Trinidad.
Oh, sister, you're from Haiti, aren't you?
Sorry?
Sister, are you your family from Haiti?
No, I'm from Cameroon.
Cameroon. Gosh. Nobody says French as their major language, their first tongue?
I beg your pardon?
French as their mother tongue.
Correct.
Bibliothèque is the French word for library.
Oui.
Okay. So bibliotherapy is giving them a book to read. I know, Kylie, I didn't make it up. That's just a term, okay? Bibliothèque is the French word for library. So bibliotherapy is not reading the Bible, it's reading a book. So to have the couple read a book would be something I would do. For my LC people, one of the most common books is the 4 Horsemen. It's by Gottman, and the Four Horsemen talks about the downfall of a marriage. Let's go back a little bit. Those that have been clinicians for a bit. Did you ever tell a couple to read your 5 love languages? Dion, if you don't know what those are, you need to Google that, okay? So the 5 love languages. It's a very important book. It helps us understand our love languages and the client's love language, or the couple, right? So when I was married, my husband would buy me gifts. He would just buy me gifts, and he would say, "Oh my gosh, honey, I went into the store and this was the first thing I saw, and it cost blah, 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 thousands of dollars, and I bought it for you." That is not my love language. I don't care how much you spent.
I would have loved him then, because that's my love language.
Could have had, because that was not my love language. You could have him. I swear. That's not my love language. My love language is make my life easier. Acts of service. Dang. Act like you the daddy, not the babysitter. Take care of the kids. Mop the floor. That's my love language, okay? But that is a book that if you ever do couples therapy, if that's your plan ever in the future, I always recommend that one, okay? It's the 5 love languages. And the goal is not only to identify your love language, but also then to know that your partner's love language. Have you guys ever really heard that book?
I heard it in grad school. I actually have the book and never really read it. But
well, that'll help you now, won't it? Aren't you married now?
Oh no,
okay,
I've never been married, but I'm separated from my daughter father.
Okay. And I'm gonna assume that's by choice. Do I say I'm sorry or do I say yay?
That's by my choice.
Okay, yay! Okay. Am I spraying the 5 love languages?
Yes.
Honestly, I don't know any clinician, no matter what level, that should not have this book in their repertoire. It is real, and not just with your spouse, with your children. Know how your children recognize love. Because if I give it to you what I think is love and you don't hear what I'm saying, they don't get it. It's a really, really important book. It's Gary Chapman. One of my favorite books. And I also say to you, if you're in a private practice, buy the book from Amazon, mark it up a couple of dollars, and then suggest your clients buy it. You cannot make them buy it. That's unethical. But if you say, I don't want you to read that book, and by the way, it's right outside in the waiting room. We can go ahead and get it from here for a few more dollars at Amazon. That's not unethical. It's okay.
It's $15 in Amazon.
So you could sell it for $20. It's not unethical. I swear it's not. It's not. People do it all the time. It's not unethical. If your office, if you use like some aromatherapy, if you like candles, whatever you do, and the client feels really great in your office, you can say, oh, by the way, we have those for sale. I just can't push them to sell it. Remember, I'm a fan. I don't believe in the poor social worker. I think that's a myth. That is not a true thing. You have your same degree that anybody else does. You had to pay the same amount for your master's. Not buying that. No poor social worker stuff. Not doing that. Okay. So anyway, those are the 5 love languages: quality time, gifts, words of affirmation, acts of service, physical touch. So the goal is, and if you Google that, there's a test. Without buying the book, you can figure out what your love language is, but also not only for yourself, your spouse, your children. So if I speak my love language to them and they don't get what I'm sharing with them, they feel unloved. And I ain't gonna lie, I like me some Tiffany jewelry. I definitely do. But I'd rather you just vacuum the floor. Let's face some facts, okay? You buy me every gift you want. But if I got to vacuum the floor, I had 3 kids. I was married, but I was a single parent. I'm gonna put that out. I was a single parent, okay? Do some laundry. That's my love language. Those are acts of service. Make my life easier.
Dr. Pam, but when you say that you kind of all of them, but one more than the other?
That's not a test question, but if you Google the quiz,
The quiz is good too.
and you can download it and just use it in your office. Use it with your kids. Use it with people that you know. It's okay. It's okay. Don't want you ever. I am such a. It's so important that you don't buy the fact that social workers are supposed to be poor. If that's what you choose to do, it's up to you. Okay. This is 5 love language, the children's profile. So this is a child who would say, I like to, oops. Okay. Okay. So if you're working with your children or your parent, a family, right? I like to receive notes of appreciation, or I like to be hugged. Which would you prefer? Anybody? Hugged or notes of appreciation? Kylie, what would you prefer? Kylie's asking her husband. Kylie, which would you prefer?
Not I statements.
You've got to pick one. Which would you prefer, 1 or 2? I like to receive notes of appreciation, or I like to be hugged. Which do you prefer?
Neither. Oh. Neither.
You don't want either one of those?
No.
Girl, that's a whole different therapy session, okay? So and my therapy rates are a whole lot higher than my tutoring rates.
Does the state pay for that?
So, Dion, which would you prefer?
I will say 2 because I'm a twin. And so
There's no excuse. There's no excuse. What do you like?
I feel like, I mean, I like hugs. I like to be.
Okay, so physical touch is important to you.
Yes.
Okay. So I can write you a 5-letter note of 5-page note of how great you are. And I've wasted my time because all you really wanted was me to hug you.
Yeah.
But that's okay. It's not a bad thing. It's just who you are.
Yeah,
So
I think the hug means it's deeper for me because it lets me know like it's the actions that means more to me than you writing it, because then I can't feel it.
And that's what this whole book is about. It's okay. It's okay. There's no wrong answer. So really, this is one of my favorite books to read. And not only for my own marriage, but also just with your clients. And again, not necessarily in romantic relationships, with kids, right? So many of us as parents, we give the love language that we like, but it doesn't necessarily match what my kid wants. And if I'm giving you what I think is what I've learned, just because I've been around the world 1,000 years, is that people speak their love language to me. So if someone buys me gifts, that is their love language. It may not be mine, but that's their love language. Okay. This one a really easy quiz. Same kind of question. Do I see it? Natalie, it's
Yeah.
more meaningful to me when, which one?
I hug someone I love.
Sister, which do you prefer? It's more meaningful to me when you're muted.
Someone I love does something practical to help me out.
Also raised 3 kids and worked a full-time job, so that's where my stuff comes from. Okay. Evelyn, what do you think?
About love?
Now this question. It's more
Oh.
meaningful to me when
Oh. Someone I love gives me a little gift as a token of our love, of concern for each other. I get to spend interrupted leisure time with those I love. Both.
you can't pick both. You have to make a choice, Evelyn. Let me say that for a second. That might be a test question. People who are indecisive as opposed to undecided. People who are undecided need more information. People who are indecisive don't trust themselves to make decisions. Okay, so indecisiveness is a personality trait where you don't trust yourself. Okay, so you got to pick one.
It's hard, but I think I will go with.
There's no wrong answer. You just got to pick one.
I'll go with the first one then.
Which one?
With the first one. Someone I love gives me a little gift.
Okay, not a big problem. Rochelle?
Yes, ma'am.
It's more meaningful to me when
When someone I love does something unexpected for me to help me with a project.
or is that your answer?
Yeah, that's my answer.
Very good, very good. So again, this is bibliotherapy. That's what I'm talking about. So that is one of the terminologies that I just want you to know. Okay. I have a handyman, guys. He came out this weekend to do some work at my house. And when he he pulled in, my car was like right, like almost in my house. And he did all this stuff for me. And then at the end, he hung a string with a bottle on it. So I know where to stop. That made my day. If that man wasn't married, whoo, okay. But that made my day. Stupid little things like that matter to me. But again, there's no wrong answer. There's no wrong answer. Bibliotherapy, okay? So back to my paradoxical, that's what I was going, that's where I was going. Paradoxical is the opposite. So I've given my clients the book to read. I've given them a test. I've given them I statements. So they haven't done one thing. So now what I'm going to do is I'm going to say, fine, go home and yell at each other for 6 hours as loud as you can. The goal of the paradoxical intervention is that I've given them all these things to do and they've done nothing. So now I'm going to tell them to do something absolutely ridiculous. Okay. I can't use the paradoxical on my first time. I've got to give them some options first. Remember, relabeling and reframing and interpretation mean the exact same thing. Relabeling is the strategic term because I want you to look at it with different words because it's communication theory. Reframing belongs to Minuchin. Reframing says, let me look at it through a different lens. Okay. Strategic family is usually short term. Structural family is long term. Structural family are the Duggars. You know, I always pick on the Duggars, right? Structural family says those Duggars, you know, I'm 7 years old and I'm making tater tot casserole for 17 people. Somehow that is not okay. Okay. We know that the terms boundaries, right, enmeshed and disengaged belong to structural family therapy. The problem is they don't have a healthy structure. Anybody done, who does family therapy? I asked this, anybody do family therapy? So one of the most bizarre things that, it was different. Okay. Is I don't do a lot of therapy. This is probably 3 or 4 years ago. I am a consultant for the school system, and this 6-year-old brought a gun to school. So they asked me to go in and follow up with this family. So I go to the family's house, and a single mom, I think she's 27 at the time, and she's probably 26. She has 4 children in a row. There are 7, 6, 4, and 1. And so when I'm working with this family, one of the things we set up was some structure. I set up some rules in the house. Okay, because structural family therapists, they don't have any rules. They're used to kind of whatever happens, we'll do whatever. And so one of the rules that rules we set up with the whole family. In this family, one of their most important rules was, if you don't live here, you can't eat here. Anybody set a rule like that? So in setting up the structure of that family, that taught me a whole lot, because apparently mom may have had many different boyfriends, and mom got food stamps for her 4 children, and the boyfriend du jour, the boyfriend of the day, would come in and eat whatever. So that family needed some rules, and they needed some structure, big time, big time. I'll continue to share. In that same family, I had a lot of countertransference issues. I wanted to choke that mom, and I really had to.
You had to how do you had to help them? Like just therapy, like as in counseling, or actually?
I was a therapist. I wasn't called in. I was called in to help figure out why this 6-year-old brought a gun to school. Okay, so part of that was in working with the family. I can tell you, I wanted to choke mama. I wanted to choke her.
Why would you want to choke her?
I'll tell you. Again, this was recent. This was like 10 years ago in my 30-year career. This was like 10 years ago. The kids I was seeing, there were 4 of them. One was my client. There were 4 kids, so I work with all of them. At Christmas time, they were so excited to go see their grandfather. And they were so excited. And after Christmas, I'm like, oh my gosh, you got to see your grandfather. Did he bring you gifts? Did you get to hug him? What was it like? They went to visit grandfather in prison. So they got to touch him, but could grandfather bring them presents? Mm-mm. And I've never felt so inadequate. And I've been working with this family a couple of months, and my client was the 6-year-old, and the 8-year-old said, he's in prison. Of course, bring us gifts. But nowhere in the session had anyone said to me, he's in prison. They were so excited to go see grandfather. Okay, so again, Dr. Pam, who was well-schooled, have seen every type of family, still messed that up, okay? So the problem with this family is there was no structure. And one of the reasons that, let me tell you my first visit to the house. Mom was a school bus driver. Mom had married her high school sweetheart, and they got married. So the 2 older children belonged to him. He was in prison. The younger ones had 2 separate separate daddies. Her mom was schizophrenic, and her dad obviously was in prison. My first visit to the house, my client, the 6-year-old, is standing on top of the stove, making hot dogs, in a boiling pot of water.
That's risky.
That's scary. Okay. That's scary. So I suggested, hey, babe, let's learn how to make those in the microwave without some water. Mom would stop by, mom worked she got off at 3. She's a bus driver. She got off at 3. She would leave the kids in daycare till 7 till they closed. Mom would go to Red Lobster. Mom would go to get her nails done. Mom would do all these things. And when the kids got home, she'd feed them peanut butter and jelly. As a mama, I wanted to choke her. I'm not going to lie. I wanted to choke her. And I'm like, I'm taking this case because the school board asked me to, and my insides are churning. I wanted to choke that woman. So what I really had to learn, and what I teach this to my students, is I had to look at the strengths perspective. I had to be able to recognize that mom was doing the very best she could. Her own mom was schizophrenic. Her father was in the hospital. She fell in love with her high school boyfriend, and she assumed that he was going to be there. And I say she was 22, but I think so. She was still very young. She was so young. I'd come in the house, and they had 2 TVs, one in the main room and one upstairs. And when I would come in the house, the TV was always on some adult TV show.
Are you talking about the same mom here that you want to choke?
Yeah.
The one that he's 22 and
yeah,
the mom was as schizophrenic and
yes. I had to learn to.
So why would you want to? That's what I asked you earlier. Like, I was interested to know what would it make you want to choke her,
because like what I said is she got off work for 3. She'd go out to Red Lobster. She'd go get her nails done, go get her hair did. And then when she brings the kids at 7, she would feed them peanut butter and jelly, or my kid making a hot dog on the stove.
But it sounds like to her, that's, I'm not absolutely, that's not okay. But in her world, in her worldview, like she wasn't raised in, I could imagine that she was not raised in a.
Absolutely. So that's what took me to get to the strengths perspective, because I'm not going to pretend it was right, but my own countertransference as a mom who's busting her butt, working 2 or 3 jobs to take care of my own kids. And I see this woman who looks like me. And at that time, I couldn't afford to get my nails done. I couldn't get my hair done every week. And she's choosing to get that done, not take care of her kids. So my countertransference was totally in the way.
In the what?
My feelings to her was a problem. It was a problem. I wanted to choke her. I wanted to take my hands around her throat and choke her. I am not going to pretend.
You wouldn't do that now, right? If that was to happen today.
But
obviously
so what I say though, I say that to say is this is a family that needed structure. They needed boundaries and hierarchies. Mom just didn't know any better. This is all she'd ever seen. She didn't know any better. She had never seen a healthy family, and she's 22. All of her friends are getting their nails done and their hair did. That's all she knows. So a structural family approach is what this family needed. Strategic is short term. They've got one problem. Structural is they don't have any rules in the house. There's no structure in the house at all. The same family, one of the boys told me, what did he tell me? I went to, again, home visit, and there were, the people next door were drug dealers. And I said, how do you know? And he's like, just watch. There's 1,000 cars coming up all day, every day. And I think that was, again, I think he was probably 5. And he knew that there were drug dealers next door. My 6-year-old that I was teaching, who was a budding conduct disorder, he got kicked out of school. He and his brother both got kicked out of school, and they were staying with great grandmother. I pull up at the house, and both of the kids have their sweatshirts on, and they have like they're holding it like this, like there's like tons and tons and tons of coins in their sweatshirt. I pull up, they're not home yet, so I'm watching them pull up. Both of them have it, like, again, this little sweatshirt tucked, tons of coins. Mom goes to the house first. All the children follow her in the house. She did not even notice the two of those kids had that much change in their sweatshirt. She didn't even notice. While I'm there, she gets a call from the great-grandmother and says, I think your kids took all my change, took my penny bank. And she's like, no, she didn't. I see it. So literally, they had a porch with slats in it. And as I'm talking to my client, the coins are falling through the slats. And mom has no idea. That's a family that needs structure. So when I say to you, strategic is brief, short term, how they communicate each other. Structural family therapy have no boundaries, no rules. They don't know who's in charge. The kids do whatever they want to do. Structural is the ones that are majorly messed up. Am I sharing? Salvador Minuchin? Okay, he's my structural guy. Okay, and again, so what he said is not financially, but families that are poor have no disorganization, are disorganized. They have no organization, no rules, no nothing. And I don't mean financially. There are people who are very, very wealthy who still have disorganized families. They need structure, and we need to change the negative patterns. This family had no structure. Mom didn't know how to set the rules. She just didn't know. And again, this is I've been in this field for 30 years. I've held everything. And to hear the family rules is if you don't live here, you can't eat here. That ain't normal. Okay. So again, Minuchin talked about enmeshment and disengaged. Enmeshed families are so enmeshed. I don't know where I start and you begin. I talk about the Duggars a lot with enmeshed families. So my Duggars, my J Duggars, when they were little kids, they're 7, 8, 9, 10, and they're supposed to make tater tot casserole for 17 people. Am I a kid? Am I a parent? What is my role? The roles aren't clear. Disengage is when you have no idea what's happening. And in that mom, she was disengaged. She had no idea what those kids were doing. No idea. How do you not notice your kid is coming home with a couple $100 worth of change? So those are the terms again. Remember, it's verbiage to learn the test. It's the verbiage. Alignments are, so in every family, mom and dad are in charge. There's no family theory that says mom and dad are equal to the kids. No way, no how, ever. Alignment mean that mom and dad should be in charge and children are below. Mom and dad have the power. And again, for the test, but for the real world, biological mom and dad. Okay. If you're working with families, biological mom and dad are the most important relationship. If it's a step parent, that's a different story, but the test, but back then at Minuchin's time, he didn't ask about step parents. Okay. And coalitions are when mom and children get together. Let's say dad's an alcoholic and mom and children hang out together. The 5-year-old still sleeps in the bed with mom. And dad sleeps in a separate room. Is that a healthy marriage? Healthy family? Not at all. Not at all, right? Mom and dad are the priority. Focus on mom and dad, and the children are supposed to toe in line. This thing is called a family map. So family mapping, again, it's not the genogram. It's not the eco map. It just talks about the relationships within the family. Okay. Again, words that we're looking for: restructuring, because your foundation is messed up. You don't have a firm foundation. Minuchin joined the family. So homeostasis is your norm. The families we work with, is their homeostasis okay? It is not. Their routine is not healthy. That mama's routine was to get off work at 3 o'clock, do whatever she wanted to do, and leave the kids in that free daycare until 7. They came home and took a bath at 8:30 and went to bed. She had an hour and a half with them each day. that okay? But that was her homeostasis. That was her routine. We know that children that are in abuse situations, when they run away, they've been taken out of their biological family, they're put into foster care, they can be horrifically abused. When they run away, where do they go? Back to the crazy. Back to the homeostasis. Okay. So terminology. Joining belongs to that family. This term, so they give a term, mimic the language of the family. There's a term called mimesis. It's not in this one. Mimesis, M-E-M-I-S-I-S, mimesis. That term means to mimic the family's behavior. What we know in general, so, and if you're trying to make nice with someone, if you're trying to get a job, if the interviewer steps back, you sit back. If the interviewer goes forward, get forward. There's something unconscious about us that likes people that are like us. So Mnuchin's job was to join the family, to really be a part of the family. Okay. Structural strategic are they come from systems family therapy. Okay. If you have any questions for me, guys, I'll pull up a couple questions and call it a night. Those who've taken the test before, have you seen the terms? I didn't make them up. I do reward according to Pam.
Yes, I've seen the terms. I recognize them.
This is a diagnostic term, okay? So this would not be evident on your test, which would definitely be on everybody else's test. I'm gonna put in your chat box so you can see it. Do I see it? Okay, it's on my screen. If you don't see it on the chat box, I have got to the restroom, guys. You're more than welcome to do it as a group if that works for you. I'll be right back.
Did you guys get B as well? Paranoid personality disorder.
Yes.
Thank you.
Yes.
Hi, what was my answer?
D.
B.
D, yes.
B.
B.
Ding, 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 ding. Very good. What's the difference between paranoid personality disorder and paranoid schizophrenia?
Schizophrenia, you hear voices.
Oh, very good, very good, very good. So paranoid schizophrenic is I hear and see things that people don't hear and see. Personality disorder is I've been that way my whole life. I don't diagnose it until I'm 18, right?
Yeah.
Okay. And again, so paranoid is like, oh my gosh, my wife is sleeping with everybody. Okay. If you're a CBT therapist, I'm going through just a couple of questions, guys. So take this one, Dion.
You are a CBT therapist working with the client who struggles with symptoms of social anxiety. She has an upcoming presentation and she reports feeling amiss, dread, and panic at the thought of doing it. You might engage in all of the following interventions, except
You're a CBT therapist. What words am I looking for?
like changing your thinking.
Got it. CBT says you've got some thoughts we need to work on. Change your thoughts, change your behavior. I'm sorry, thoughts, feelings, behavior.
Yes.
Okay.
So engage in all of them except guided imagery, cognitive restructure, change thought rate. Miracle question.
Who does that belong to?
I'm trying to remember.
Solution focus.
Yes, yes.
Solution focus. So, Evelyn, what's your question?
Oh.
Just to clarify, this question tests are also applicable for BSW?
You would not see CBT on the BSW. You would not. The last one, though, that first one, you wouldn't either. Let me give you this one. That's a that's a bachelor's level question, Evelyn. Look at that one.
But should I stay or should I leave? I'm not sure.
No, I'm really going to go a couple more minutes. So look at this one.
Do you want me to answer that?
I would.
Oh. If a client's privilege is being challenged in court, whose responsibility is it to assert the privilege, their privilege? The therapist, the client, the lawyer, the judge.
So if a client's privilege has been challenged in court, what is privilege? That's a code of ethics question.
It's like the client has some rights.
Privilege is the legal term for confidentiality. Mm-hmm. So when a client tells me something in confidence, most often they have no reason to think that it'll ever, there's no reason to think anybody will ever hear this. Okay. So now I am a social worker, and now the judge says, I don't know about that privilege. Whose responsible is it to assert privilege? So if you tell your doctor something, you tell your lawyer something, you tell someone that you really trust something, you have no reason to think they'll tell anybody else. You can tell your lawyer all day that you're guilty. I did it. It was me. I did it. But your lawyer can't say anything. So who's responsible? Who's supposed to claim privilege?
The judge?
The judge is going to either talk about my privilege, but he's not. I'm the one who's claiming privilege. What's the client? Okay. Privilege means I am protecting my client.
Oh, I think you mean like the court is asking for documentation. Is that what you mean?
So let's go back. Let's just look at the code of ethics on what it talks about, because this is the history. Rochelle, are you still? You have struggled with privilege for a long time, haven't you?
Yes.
Okay, Rochelle. So tell me what it means.
When you insert privilege, and then like you're trying to protect your client,
I am.
that you're going to keep the secrets that the clients tell you.
Can I guarantee that?
But I'm confused about that.
Can I guarantee that?
No, because if the judge tells me to talk, then I gotta talk. You could say limit the scope. Because you don't want to go jail.
I don't want to go jail. I
But that question we just looked at confused me.
And it's okay. It's okay because it's okay.
Okay. Okay.
Come on, where are you? Okay. Okay. Am I sharing my screen?
Yes.
This is the NSW Code of Ethics that applies to everybody on all levels. Okay. So 107.A says social workers should respect clients' right to privilege. Social workers should not solicit private information from or about clients except for compelling professional reasons. Once privileged information is shared, standards of confidentiality apply. What does that mean? Anybody?
So it means so bottom line, social workers must respect clients' right to privacy. So that includes requesting information from third parties about the client.
No, you're thinking too much. I just want you to stand the question. Social workers should not solicit private information from or about clients except for compelling professional reasons. Most of you in your office, you have the exact same psychosocial form. You ask every single client the same question.
Yes.
Do you know that's unethical? I should only ask them a question that applies to them.
Problem.
How much you make? Does that apply to every client?
No.
Your agency might want to know that, but the Code of Ethics says you don't need that information. That's not okay. Are you straight or gay? Do I need to know that every time? I do not. I do not. So again, that's one of the many ways agencies violate a client's Code of Ethics. Okay. B says social workers may disclose confidential information when appropriate with a valid consent from a client or a person legally authorized to consent on the behalf of the client. Okay. So confidential information are things that you told me that you told me in confidence that you don't think I'm going to share. Right? You told me you killed your wife 3 years ago and she's buried in your backyard. I ain't trying to share that, am I? But what it says is social workers may disclose confidential information when appropriate or with valid consent. Remember, we have the same rights in life as we do in death. If I die and someone wants my records, can they have them? If they're legally authorized, they can. If I left someone in charge of my end of life advance directives, I said someone's in charge of that. If there's someone legally in charge, then yes. However, if not, that means you have to go to court. And someone has to, the judge gets to make that decision. D, if social workers plan to disclose confidential information, they should, when possible, inform clients about disclosure and discuss potential consequences prior to disclosure of the information. This applies to whether a social worker discloses confidential information on the basis of a legal requirement or a client consent. Okay, this is a common question, right? If it says, should I discuss their legal stuff? It's right there. The rules are very clear what I'm supposed to do. Okay, so going back to the question, oh, I missed that question. So if a client's privilege has been challenged in court, the client told me this, I claim privilege, who's responsible to assert the privilege?
Oh, never mind. I see the word challenge now in court. So that means,
Okay.
yeah, so it's me.
Okay. Natalie, did you take one already?
All the following represent potential crisis issues when it comes to treating a client in a manic episode, except a dangerous business.
Hold on. The except questions are so hard for me. 3 of these things are okay. 1 of these are things that I would not do. I've got a potential crisis and he's in a full-blown manic episode. That's bipolar 1. Off the chain, right? Spending money you don't have, sleeping with people you would never sleep with, just bizarre behavior. 3 of these things I can do, 1 I cannot. Go ahead.
A, dangerous business investment. B, sexual indiscretion. C, suicide ideation. D, severe loss of energy.
Roll out.
So when a client is in crisis and is in manic episode, sexual indiscretion is 1.
I should expect that, right?
Yeah.
Okay.
I should expect A.
Got it. Now between C and D, which I should expect, which one should I not expect?
I should expect D.
I should not expect D.
Okay.
If they're in a manic episode, they're on the chain. They hadn't slept for 3 or 4 days. They think they the bomb diggity, right? I hope that the world recognizes when Kanye West was telling the major corporations to go screw themselves. I hope everyone understands that that was a manic episode. I like this one. Okay, sister?
You are a licensed therapist shopping at the grocery store when you observe a woman next to you slap her younger daughter in the face. After the incident, she looks at you with an embarrassed expression and walks away hurriedly. Her daughter starts crying profusely. Given this information, what should you do? So they say, I'm a therapist. I'm at the grocery store and I observe a woman slapped her younger daughter on the face. And after the incident, she looks at me with an embarrassed expression and walks away hurriedly. And her daughter starts crying. So they're asking, given this information, what should I do next? So they say, call law enforcement if you feel it is necessary, but you are not obligated. Catch up with the mother and offer her referral for parenting classes. report the incidents to law enforcement because you are a mandated reporter, or review your state laws to determine if you need to make a mandated report. So what I will not do, what I will eliminate, I will not catch up with the mother and offer her a referral for parenting classes. I won't do that one. Then
You're in the grocery store.
I beg your pardon?
You're in the grocery store.
Correct.
Right? You're shopping at the grocery store and you see a woman slap her kid across the face.
Yeah. I mean, I don't know how, so I will not catch up with her to be, I mean, I will refer her to her, so that's why I'm eliminating that one. So then the next one will be review your state laws to determine if you need to make a mandated report. I won't do that one either. So between A and C, call law enforcement if you feel it is necessary, but you are not obligated, or report the incidents to law enforcement because you are a mandated reporter. So from the incidents, I think I'll just report the incidents for safety of the child. So, I mean, they didn't say like they didn't. I mean, there is no wound or nothing. There's no threat. So maybe I'll go with A. But I'm not, because I mean it is not like death. Yeah.
Okay. We're in the grocery store. Do I know this woman? Is she my client?
No.
Okay. So that is one of the times you get to really use some of your own judgment. Okay. I will tell you personally, what I normally do is, because I'm a parent and I understand what it's like, I usually say, hey, mom, it's tough being a parent. Let me help you. But I don't have any legal obligation from the grocery store. I don't know who she is. Okay. 14, Rochelle.
A client shares that she recently loved a book she read about depression. Upon hearing the title, the therapist states that she also loved the book. This therapist intervened by A, building rapport, B, validating the client's feelings, C, engaging self-disclosure, D, practicing biblical therapy.
Bibliotherapy.
Bibliotherapy. Therapy.
Like I said, that talks about the love language. Have them read a book.
Okay.
What's your answer? I don't know that's the right answer. I'm just saying what bibliotherapy
Yeah. A, building rapport.
A client shares that she recently loved the book she read about depression. Upon hearing this, the therapist states, oh gosh, I think so.
A.
Stop guessing. No guessing. No guessing. Stay in the question. She says, I also loved the book. If I tell you something about me, what is that?
Oh, see, engaging in self-disclosure.
Okay, Rochelle, tell me why you struggle with that one. Anybody that struggle with that one. Why was that a struggle?
Because I thought we're not supposed to do self-disclosure.
Does that question ask me that? You're absolutely right. We're not supposed to. But it's the question asking me whether it's right or wrong?
No.
It's just a recall question. It is just, do you know that this is self-disclosure? There's no right, no wrong, no you shouldn't have. It's just about the recall. What is this called?
Well, that's why I didn't want to choose that for the answer.
Okay, you were thinking, weren't you?
Yes.
Does it say anywhere in the question that therapist is unethical?
No.
It does not.
No.
And you're absolutely right. We're not supposed to do that. You're so right. But the question didn't ask me about right and wrong. The question just asked me what I did. Okay. Do you see how that's thinking and not reading?
Yes.
I understand their heart, and I swear they're not trying to trick you. They're not trying to trick you. Self-disclosure is not okay. It's not okay. But she did it. And it's asking me. And do you see that? Read a book. This is one of the questions I think that they're, okay, obviously they're not trying to trick you, but maybe they are. It says she also loved the book. I know bibliotherapy says, hey, go home and read this book. But in this situation, the client read the book first, and the therapist said, oh, that's a tough one. Everybody see how well that's right.
Mm-hmm.
That's a tough one. I am not going to pretend that's a tough one. That's a tough one. You got this one, Evelyn? Structural family therapist.
A structural therapist largely aims to change a family's organizational structure, change cognitive distortions in families, change inefficient family boundaries, change resistant family patterns. Ooh, that's a tough one. I will discard A. I will discard C.
Let's go back to the question. What does structural family therapists say? What's the goal of a structural family therapist?
To organize them?
Structure means, I talked about the family that with the drug and alcohol use, they were a hot mess. They were a hot mess. They needed some rules. They needed some boundaries.
So is it A then, the correct one?
Are you sure? No guessing. This is not a guessing test. No guessing. What can you rule out for sure?
For sure, I will rule out C.
Okay, C is change inefficient family boundaries, but structural therapy does talk about boundaries. Does.
Yeah. Okay, so
I'm going to take out B, cognitive distortions is CBT, and how I process, how I think. I'm going to take out B for sure. Okay. I'm also going to take about D because it's resistant family patterns. Structural, it doesn't talk about that if you're resistant. That leaves in between A and C. Between A and C, which of those, and I think this is a typical test question on all levels. I have to really understand what a structural family therapist do.
Maybe C then?
What's the difference between A and C?
Well, it could be A too.
No, not thinking. You're just all across my page, Evelyn. Why? Tell me why.
Okay, it's
and
A.
I'm not picking on you, baby. I love you dearly. I'm not trying to pick on you. But
so I would say
this
A
is how the
because
test goes, right? You get down to 2.
So I would say A because a structure is in the question and in the answer. I don't know. I think so. Is that right? Because the word is in both.
So C says change inefficient family boundaries. I may have to change family boundaries, but my goal is to restructure, reframe, set up an appropriate hierarchy in this family. It is not okay that my 6-year-old that I was treating was standing on top of the stove boiling hot dogs. That is not okay. Everybody get that? Yo, Evelyn. Yo, Evelyn. Yeah.
Yeah, I'm ready to fail this.
Oh, you are not. Bentley says, hey, Bentley Cooper says, thanks. I say, good job, Ed. Ah. Kylie?
Your client Brett is struggling with feeling anxious during math class. He states that he becomes easily distracted and starts worrying about how he will ever pass his test. As a strategic family therapist, you decide to engage in paradoxical ordeal. In doing this, you would best. So you have
That's my question. Okay.
you have a client who is taking a math test, and he's become distracted and starts worrying about how he will pass the test. So you are changing his thought process.
What is that?
Or-
Where do you see that?
Paradoxic
Is the
you are
opposite. The opposite.
right.
Paradoxical is reverse psychology. I'm trying to get you to understand that what you are doing isn't working. So I'm going to give you the opposite to do that lets you know that you're wasting your time, because I've given you other stuff and you didn't do any of those things.
So can you scroll down a little bit?
I can.
Instruct Brett to consider changing math classes altogether. Instruct Brett to imagine the worst case scenario associated with failing his math class. Instruct Brett to practice deep breathing during math class. Instruct Brett to exercise for 20 minutes after school and dedicate his math class worries to that time.
So let's go back to the question. The biggest issue is he's feeling anxious during math.
Yep. So we're getting rid of D.
He feels anxious and during math. So if I say to Brett, I want you to exercise for 20 minutes, and the whole time I want you to focus on math.
That makes no sense.
I know. The paradoxical is that what I want him to, it's reverse psychology. He says, I feel anxious during math class. So I'm trying to get him to understand that makes no sense, Brett. That makes no sense. So what I want you to do is, whenever you are not feeling anxious, focus on what causes you anxiety. The opposite. I don't want to change his math class together. Worst case scenario is not paradoxical. So C and D are my only choices. Deep breathing is systematic, what's it called? In vivo systematic desensitization. Learning to be less sensitized to what's going on. Keep talking to me, Kylie. Look, I see. I think that you are like Dr. Pam. You're lying. I see that you screenshotted it. We can talk about it later. Okay.
Yep.
I love this question. Natalie?
You are providing teletherapy for your client and observe as they start sipping from a glass of wine. They acknowledge that it's wine and announce that it feels great to just have therapy and decompress from the week. Ethically, you should next. Okay. So the question is saying, I'm providing teletherapy for a client and observe that the client is drinking a glass of wine. The client acknowledged that it's wine and announced that it feels great to just have therapy and decompress. So ethically, what should I
got
do?
a wine glass in front of me. I don't. I was like, oh, Natalie, oh, it's so great that you're with me. Okay.
Okay. So A, let them know you cannot continue session with them drinking and reschedule for another time. Let them know that you need them to abstain from alcohol for all future sessions. Let them know that alcohol can make it hard for them to remember what you discussed in therapy. D, let them know that you cannot maintain confidentiality about the alcohol consumption.
So I know it says next, Natalie, but what does next mean?
Assess first.
It's the same as first. Absolutely. It's the same as first. I'm sitting in the session. There's another question that says the person starts to smoke a joint. Dr. Pam is firing up a doobie. That's the right term. I don't know if that's the right term or not. Okay. So
I will eliminate C.
okay.
I will eliminate D. Let them know that you cannot maintain confidentiality about the alcohol consumption.
Okay. So do I really care if there's no confidentiality about alcohol, is there?
Repeat that.
There's no confidentiality about alcohol.
No.
Yeah, he's not 12, right? So yes, that's out. Okay. Now you're between A and C.
A and B. I'm between A and B.
Okay.
So A said, let them know that you cannot continue session with them drinking and reschedule for another time. And B said, let them know that you need them to abstain from alcohol for all future sessions.
The question is, what would I do first? And I know it says next, guys, but I'm always thinking, what would I do first?
I would choose A. Let them know you cannot continue the session with them drinking and reschedule another time.
Yes. Written different way, common test question. A client shows up and they report they have one drink. Code of ethics says, okay, well, my grandma would say, if you ain't in your right mind, I can't treat you.
Yeah.
Okay, that is the Ebonic version of, right, what the code of ethics says. I can't treat you. Yes, you have one glass of wine, but do I know how many you've had before? Okay, so I'm going to say, come back another time. Absolutely. Very good. And I know it says next, but remember, next questions are still first questions.
Dr. Pam, I was thinking when that on with the question we just left off of, if you say you have to abstain from your next what was it? It says your next future whatever appointments or whatever. I'm thinking the client is still sitting there like
Absolutely. Go ahead and finish that. Don't. The next time, don't you drink anymore.
Right.
That's not what I would do first. Right? I can't have a session. Honestly, so the Code of Ethics talks about, there's a question many times about someone who is schizophrenic. If a schizophrenic is not in danger of hurting themselves or others, I can't hospitalize them. I can't, right? We have so many homeless people that are schizophrenic. But the Code of Ethics says, if it doesn't say that, it says if you're not capable of making decisions, if you're not using the best, if you ain't in your right mind, that's not what it says, but that's all I can get in my head. If you're not in your right mind, you've lost the right to self-determination. You've lost that right. That means I get to make decisions for you because you are not capable of making decisions. It doesn't say that verbatim. Okay, it does say something about I'll find it and tell you what it says. But if you're not capable of making decisions, you've lost that right. Okay, last one. Leon?
A female Caucasian therapist has started working with a Japanese couple on issues related to infidelity. This therapist at times finds it hard to connect with her clients due to their cultural differences. To help with this difficulty, she should consider all of the following except. So we have a white female therapist, and she's working with a Japanese couple on issues with fidelity. This therapist, she's finding it hard to connect with them because of their cultural differences. Mm-hmm. Now she needs help with this couple. And what should she consider? I'm going to look for what she should consider.
All right, so three of these things are things she should do. One is something she should not do.
So 3 of the things, let's see. A, recognize her own biases when it comes to culture. B, asking the couple to teach her about Japanese cultural expectations. C, reading about cultural expectations among different ethnicities. And D, seeking consultation from therapists who have worked with this population. So I would not ask the couple to teach her about Japanese cultural expectations. Wait, hold on. Seeking consultations from therapists who have worked, reading about cultural, recognizing. I'm going to say I'm going to do everything but B.
It is okay to ask them questions. It is okay to say, so for the holidays, what do you do? But it's my job to learn, not their job to teach me. Okay? So my job to learn, and I can definitely ask them questions, but their job is not to teach me about cultural terms. Okay? Okay, I know I said that was the last question. I just want to pick up a couple. Oh.
Thanks for giving me that question, because I've been working on those today, and I'm like, uh-oh, I think I'm doing good.
Yes, you did. Look at you. This is a recall question. Sister? One day I'm going to get a life, guys. We're going to end on time. And you're more than welcome to leave anytime you like, but I have nothing else better to do. So
all the following are true about antisocial personality disorder, except. So antisocial personality are those that are against the society, that are like criminals. And so they're asking like, which of these is true to this group, to antisocial? So A, individuals deceive others for personal pleasure. B, individuals show a lack of remorse when hurting others. C, individual must disobey conduct disorder symptoms before age 12, must display conduct disorder symptoms before age 12. Or D, individual disregards the safety of others. So what is true is D is true, and C is true, B is true. So what is not true is individual deceive others for personal pleasure. That's not anti-personality.
oh, when can I diagnose them?
Sorry?
When can I diagnose an antisocial?
Is it before 12 or before 18? Okay.
16.
16. Okay.
6 to 16 is a conduct disorder. But at 16, I can diagnose them with a personality disorder. Borderlines and antisocials, the only two that I can diagnose are for their adults.
What do you mean by I can diagnose? I thought we're not supposed to diagnose.
At your level, you cannot, Madeline. Okay, but as you become an LM and an LC, you definitely can diagnose.
Really?
Yes, you can make lots of money, Evelyn. That's why you want to stay in school.
Maybe I should be coming the other way then.
Well, you've got to get through all those things, but definitely you can diagnose. You definitely can diagnose. Take this one, Evelyn.
You typically treat clients with anxiety disorders in your practice. You are referred to work with a young adult. After several months of working together, she discloses that she binges and purges several times a day. You have no experience with treating eating disorders. Ethically, you should first.
So here's a rule. If I've never met the client, if it's a consultation, they call me, we don't have a relationship, I can refer you out automatically. You call me and say, hey, I'm looking for a new therapist and I have an eating disorder, I can say, sorry, that's not in my realm of expertise. Bye-bye, here's a referral. But in this one, I've been working with her for a couple of months. So the code of ethics says I can't abandon a client, but I'm like, whoa, over my head. Okay, so then what would I do first?
What I would do first,
Let's rule out. What would you not do?
Well, the one that I wouldn't do would be, I think, D, because it doesn't say, does it say anything about anxiety there? I don't see the anxiety in the question.
Yes, you do.
Where?
Read that first line again.
Oh my gosh. I'm sorry. Yeah, this is why.
Did I think she was reading text? Did I say reading text?
Yeah, I need a paper. I need a paper test. Okay. Okay. Never mind. Okay, so I think I would do.
What I want you to do is tell me what you would not do.
Okay.
Let's rule out. Always rule out. Okay.
Yes.
What would I not do?
A. I won't
Okay.
do. I will probably don't do C. So it was between B and D.
I'm going to tell you a key to a tip. So do you see how A and B are very similar?
Yeah.
That means they're so similar, one of those had to be the answer. When I see things that are that similar, that's a key, okay?
Oh.
Scope of practice or scope of competence. When those are both there, one of those has got to be my answer.
What's the difference?
Exactly. That's the key there.
No, what's the difference?
Scope of practice is what I've done. Scope of competence is what I know.
Ah, right.
But you see how they're both really similar?
Yeah.
When I see that on a test question, when they're both very similar, I know one of them can't be true.
Mm-hmm.
That's a test tip. That's a test tip. No matter what I'm answering, if I see that they're both very similar, that both of those can't be right.
Mm-hmm.
Just a tip to how the tricks and tips of how to answer the questions. Okay, guys, I gotta let you go. I'll put some questions and some things in your chat box. Anything else you want to ask me?
Happy Thanksgiving, everyone.
Bye, guys.
I find difficulties assessing the questions, like when you put them for some reason.
Happy
Say again,
Thanksgiving.
sister. Well,
I find difficulties kind of like going back to review the questions when you say you provide us with questions. For some reason, I've been struggling with that. I don't know how to or where to locate.
Okay, I lost you. Say again.
Like you said that you will give us some questions, right? That you
They're
so
usually in the chat box. Do you not see them in your chat box? in the group chat box, not yours, in the group one.
Okay, I'll need to look. I
Okay.
don't know.
Sister, if you can't find them, just send Prudence an email.
Okay, please. Thank you so much.
Not drpam2020@gmail.com. Just send Prudence an email.
Yes.
Okay.
Happy Thanksgiving.
Thank you. You too.
Thank you. God bless.